50% bone loss is usually the marker for extractions. In other words, to clarify that, I think a lot of the literature and a lot of the decisions that are made in our dental operatories are based on that 50% rule, and that couldn't be further from the truth. So I'm glad you brought that up. Let me clarify that. When we are looking at our radiographs, we have to make the determination on a lot of factors. The age, is the owner going to bring that patient back in the interval that is going to allow us to maintain the bone at the current level? And so if we've got an owner that is not going to be compliant, maybe this is the first time and the last that you'll be able to see that patient. In some cases, if you have 25% bone loss, let's say, and you're not going to be able to maintain that small breed dog any more frequently than once every couple of years, you get that patient back and that 25% becomes 50% in a number of months. So it's best a lot of times to extract under those circumstances rather than to allow that to progress. So that kind of puts it in perspective. In a large breed dog, that might not be a problem. As long as the gum's okay and maybe the recession has followed the bone level and the gum looks good, in a large breed dog, that might not be an issue, especially if it's an older dog. But in small breeds, especially less than 8 years of age, if you've got those kind of changes and you don't have a compliant owner, then you're probably going to want to err on the side of extraction with not even 50% bone loss. So I hope that clears that up.